Hey guys, what is up? So, as you can see, the drug that we're going to do today is called sulfur. Now, this has been an on demand drug since the beginning of the channel, and I'm going to promise that it's going to be worth all the wait, although the wait would be 4 to 5 years long. And the easiest way that I could come up with to remember this drug is it's hot, burns, and itches. I'm tired of this shit. So, if you know me or if you know any of the drugs that we've been doing on this channel, I'll take up a couple of words and then summarize the whole drug picture here. For this, I have used Alan's keynotes. So, it's going to be mostly based on that. Let us start with the first part, that is, it's hot. Right, so the first thing that could probably come to anybody's mind is, if you know a little bit about homeopathy, is that the person has a hot constitution, right? So he's in general a person who feels hot a lot about a lot of things, right? Coming about constitution, there are a few other things that would keep in mind. That is, he is quick tempered, somebody who gets angry pretty easily. Also, he has a bit of quick motionness, that is, he's hurried. Alright, so when I talk about hot constitution, I generally mean that he's somebody who feels hot a lot. So, either that he's generally somebody who feels hot a lot, and we're going to bring that back again in some point of time. The second part is that it's probably climacteric age and the person is going through hot flushes, right? So it's a climacteric age group where the person is going through hot flushes and he feels his whole head, whole face is hot and heated up. Third, it could be because of some congestion or acute inflammation. Correct. So now, just briefly explaining, I'm using Alan's keynotes for the reference because I wanted to make sure that all of the points on gist is covered. Congestion or acute infection. Now, Allen mentions that congestion is usually of a part, not of the whole body, but the part could be anything. Okay, it could be any single part, and it also talks about portal congestion. Now, every time when we talk about portal congestion, we have to remember that there is a possibility of liver involvement, and whenever there is a possibility of liver involvement, there is a possibility of chronic alcoholism. Alright, so far we are clear. The person could be really of hot constitution. It could be of climacteric age with hot flushes. And then there could be congestion or acute infection of part. There is also mention of portal congestion. And then we come to why would else somebody feel hot, right? And that is because the climate is really hot. Although this all sounds dumb, but if you think about it, you are already done with a major chunk of the remedy, that is heat exhaustion. Again, coming back to the drug says it's hot, burns, and itches. I'm tired of this shit. Why is it hot? Because maybe the person is of a hot constitution. He might be, oh, actually, she might be having hot flushes in the climacteric age group. There could be congestion or acute infection, or there could be heat exhaustion, that is external heat, a lot of external heat, which tells me that the person is sensitive to external environment. Any changes would affect him drastically, any external changes. Heat exhaustion also talks about dehydration, correct? And here dehydration states, which could be kind of related with pain in calves. They usually pain because of dehydration and loss of sodium and potassium. So dehydration again, right? Then most of the discharges are also going to be hot and acrid. There is one other thing which you can remember through this. Now coming back to hot constitution, what the books also mention is that the person, especially at night, they need to kick off, or they really need to remove blankets of their feet because they're feeling hot, and they need doors and windows open. This is the hot part. Let's do something a bit simpler meanwhile, which is I'm tired. Okay. Now, when I say I'm tired, I generally am trying to emphasize on the word tired here, and I will just draw it here. Okay, so when are we usually tired? So, in context of sulfur, there are two things. One is mentally the person could be tired, which is the book mentions too lousy to rouse, and the second thing it mentions is too unhappy to live. And otherwise, which we could also understand, is when would a physician be tired? When they are constantly trying to treat the person, but there are multiple relapses. So again, this is an important part. Sulfur is a good remedy when you have multiple relapses, remedy is not working, it's working for a while, the patient is better, and then he relapses again. So you would recommend them sulfur, at least a dose of it. Somebody who has multiple medications in the past, it mentions about skin, and it also mentions about an ointment for piles. So something like that, where there has been multiple medications in the past and been multiple relapses, you could think of sulfur. It's not like you've made a mistake in prescription, you've prescribed well, even carefully selected remedies fail, especially in acute illnesses. For chronic, we give sorinum. For acute, if they're completely failing over and over again, you can think of sulfur. So we're done with two parts, that is hot and tired. Now let's go to the next one, which is burns. Now, burns would probably take a bigger part of this section, because if you know, then in sulfur everything burns. I'm going to try to draw a bit of the diagram here. Here we go. This is a simple, very simplistic diagram. You probably can draw it a lot more better. What I'm trying to explain here with this diagram is the person is actually very lean. Okay, you stoop shoulders. This is again going into the constitution. Lean, stoop shoulders, but with a pot belly. Important to remember pot belly, because pot belly generally tells us about the malnutrition status. Secondly, I've tried to make a seat for him. The person cannot stand, uncomfortable while standing, he always needs to sit, right? And these are some torn clothes, which means that he's not well kept. He doesn't like to be uh, bathed or washed, and for him everything will be beautiful, even rags are beautiful. And so he's not usually well kept, dirty smelling person. Okay, now that we know how the person looks, let's get into the burning part. I would start from head to toe. Okay, starting with vertex. So in vertex, we have symptoms of headache. Headache again would be because of heat, so you could add in here as well, heat headaches. And they're very periodic, once a week or once in 2 week. This is important to remember, once a week or once in 2 week. That is the heat headache or periodic headaches of sulfur. Other thing about vertex is that the vertex is usually hot. So again, same parts here, the vertex is hot, at the same time the feet are cold. This is in the daytime, but there is another contradictory symptom, that the feet become hot at the night time. We will come to that. We've talked about vertex, heat headache once or twice a week. uh, then we go on to the next part. The next part is your eyes. So if you are a little bit smart, you could have already guessed there is smarting in eyes, there's pain and burning. Next we go is to lips. Now a very peculiar symptom that is mentioned about lips is it's red in color, as if blood has burst through it. That again talks about congestion. So if you see hot and burns are going hand in hand, it's too red, as if there has been a blood burst there. After eyes, lips, we could go to face. Again, face will feel a lot of heat, talks about hot flushes. So face, hot flushes. Then we go down to throat. Throat, again there will be burning in the throat. Then we go to chest. Chest, again there is burning which rises up to face. So the burning in chest rises up to face, talks about acidity or something of that sort, not very chronic, uh, acute, and not very complicated as well, psoric in nature. Then we come to stomach again. So if there is burning in stomach, it's definitely again acidity, some acid peptic disease, probably a liver issue because we've already mentioned chronic alcoholism. Again, there's going to be burning in stomach. One more thing that we can add on in stomach area or belly region is, remember that he is pot bellied, and also you could add on that he feels there is a child in stomach, so maybe a lot of bloatation. This symptom is again seen in Thuja, and there's one more remedy. You could comment down below which remedy it is. It's saffron, right? So the second symptom in stomach, one is burning, of course, and then there is a feeling that there is a child in the belly, chest, stomach, and in scapula. This one is a peculiar symptom. There's burning in scapula, between two scapula, right? Again, so this a very interesting symptom. For stomach, one more thing that we could remember is hunger. Hunger, which is exactly at 11 a.m. Cannot wait for lunch. He simply cannot wait for lunch and he wants it right away. We move down from stomach to rectum. Any smart person could say what it would have is burning. Uh, the rectum would be red in color. It's going to be burning. The discharge is going to be acrid. There's going to be pain. There's going to be probably hemorrhoids here. So we talk about rectum. We also talk about urine. Urine, again burning, scalding. It feels, it burns literally while it passes. There's a mention that fire in ripples. This you could correlate with any acute infection. Any acute infection, urethritis, probably a UTI, which could lead to fire or burning. Again, more acute in nature. Uh, then we go on to the last and the most important part in burning is the soles. Now, as I mentioned, soles are initially cold, that is cold in daytime, and burns at night. Now, this burning probably is because of some neuropathy. It's could be more of a chronic in nature because usually soul burning is not acute. It burns at night. That makes me bring about the hot constitution again. He will kick off the blanket, which we've already said here, and there are suffocative attacks at night, which again talks about the hot constitution where the person wants doors and windows wide open. So like if this is a door and window, he wants it wide open and he wants a lot of air coming in because he's literally suffocating. And lastly, something that we missed and something that is most important and everybody should crib about, if I forgot to mention, is the skin. You could mention everything: hot, burns, itches. Um, Usually vesicles might not be very reddish in color but are definitely burning and definitely hot. Presence of acute infection again there. The person scratches and it bleeds. This brings us to our one of the other element, that is itches. Itches is mostly in the skin. Itches also at all orifices because of the discharges. All orifices are also red in color. The person also has a very dirty, filthy look, and he doesn't like having bath. Also could tell us about why all the itching and all the unusual symptoms. And there are multiple more Symptoms for skin mostly revolving around heat, burns, itch, scratching, bleeding, just over and over, same thing. You could apply it anywhere. If you could apply for acne, you could apply for tinea, but those symptoms have to be present. It should itch, it should burn, and it should bleed if scratched. That's it. That's the whole skin part. And lastly, we come to the shit part. There is diarrhea and there is constipation, which is alternating. Of course, if you've read a bit of material, you know this is bound to happen. Now, talking about diarrhea, one thing I want you to remember: too lousy to rouse. He's too lousy to rouse, he doesn't want to wake up, but the diarrhea happens early morning. He has to wake up because of that. They are painless. Important thing. Constipation, on the other hand, is painful. Painless diarrhea, early morning. Bowels are too weak to retain, and that's why he has diarrhea, which drives him out of bed early morning. Constipation, on the other hand, is uh, slightly opposite. Constipation doesn't go for days altogether. The child is too afraid to pass stools because they are painful. Stool is hard, dry, knotty, as if burnt. Reminds me of bryonia. You can see here it's really hard, dry, and knotty. It's painful, and the child or any person is going to be really afraid to go and pass stool. Diarrhea alternating with constipation reminds me he's constipated, he takes a lot of drugs, he lands up with diarrhea, he stops the drug, he lands up with constipation. The bowels is weak, multiple drug abuses, you think of sulfur, relapsing symptoms, you think of sulfur, and most common modalities, if anybody had to just simply guess, is that he's going to be worse in heat. One very common, he's going to be worse with having bath because he really dislikes it. And that is it, that is the remedy. Let me just quickly check if I'm missing on something. At the part of congestion, we could also add that there is exudation or collection of fluids in pleura, brain, lungs, or joints, which is again similar to bryonia, and sulfur will help in reabsorption. We are done with modalities as well. We know 11 a.m. It's mostly right sided. If we were to give vesicles here, which also burn in the mouth or ulcers, then it would be right first and then left. And that is it. That is the remedy sulfur. I will just re-emphasize on it's hot, burns and itches. I'm tired of this shit. If you remember these words, we just quickly revise it. Hot is hot constitution, hot flushes, congestion, heat exhaustion and discharges. Burns all over the body from head to soles. Itches mainly the skin part and all the orifices. Tired is mental and physical. Mental could be because of the depression, physical is relapsing, and so the physician is tired. Shit again could be related to stools, diarrhea, or constipation, which is both alternating. I don't think you are going to find any simpler version of sulfur, which is so most important remedy that without which you cannot practice homeopathy. In case you've enjoyed learning it with this method, I know this was a pretty long video, but please hit the like button and share it amongst your friends. And I'm going to bring in more remedies which are polycrest in nature and going to try to put it in as simple way as possible. Alright guys, thank you so much. Please hit the like button and share it with your friends. And if you haven't subscribed already, please do subscribe, and we'll see you next time.